Sometime around 1 o'clock in the morning on Saturday, the 22nd of August of this year, my father, struggling with knee problems, some generalized weakness, lack of appetite, and lethargy, tried to use the portable urinal he kept by his bed to limit those middle-of-the-night trips to the toilet. Sounds a little gross, I know, but certainly not when the alternative is a 10 or 20-minute ordeal of struggling to the bathroom and wondering what in the hell you're going to do if you don't make it there in time. But that night there was an additional problem. He was having trouble going. He tried to adjust his position sitting on the edge of the bed, and suddenly the mattress shifted underneath him and deposited him gently on the floor. He might have been in nothing more threatening than a seated position there. But with his knees as bad as they are, there was almost no chance he was going to get out of it without help. For reasons that would later become apparent, my father would pretend to himself that that wasn't true. He decided to believe that he would soon be feeling better and would be able to get up on his own. He thinks he dozed much of the night. As it got light out, he realized his cell phone was within grasp, and he called me. Not to say he was in trouble, never mentioned it, but only about the move we were planning for him to his own place closer to me. He never mentioned the precariousness of his position. He'd now been stuck on the floor for about 7 hours. Sometime in the afternoon, between the dehydration and the exhaustion, the hallucinations started. He heard my sister and her family in the hallway outside his bedroom. He could feel the vibration of the footsteps of his grandkids running up and down. In a startling tribute to the imagination's ability to make a hallucination like this one completely self-contained and impervious to logic, he heard his daughter say, "Don't bother Grandpa, he's resting." He thinks he smelled cooking. My sister and her kids were, in fact, in upstate New York at the time. My dad found himself increasingly angry, and finally, sometime after midnight on the morning of Sunday, August 23rd, he phoned her and demanded to know why she had been in the house, without so much as giving him the courtesy of peeking her head in to see if he was all right. Only after her repeated insistences that she had been and was 330 miles away and had been all day did reality regain control. My father apologized. My sister called the neighbor. The neighbor called the cops. There was never an official diagnosis of just that one incident that night, but I've gone into such excruciating detail because of what I was told that night by the doctors at the ER at which I joined my father, and what I have been told by other health professionals since. The hallucinations almost certainly were provoked by dehydration, and if not renal failure per se, then certainly a kind of temporary shutdown of the kidneys. By the time he got there, it had been more than 24 hours since he had triggered this cascade of problems by trying to adjust the position of his body so he could urinate, and still he had not done so. My father's kidneys were in trouble. Considering that kidney disease was what killed his father, this was very bad news.